Hello to all. I am Vishnu. Yesterday we discussed about insomnia, the normal sleep cycle, and different stages of the sleep cycle. We talked about REM sleep. We talked about NREM sleep. If you haven't seen that video, please go to that video. There I have explained about sleep cycles, how the circadian rhythm is maintained, which are the different biological molecules which influence the circadian rhythm. And yesterday we talked about insomnia, which is a very common sleep disorder that is seen among a majority of the population. We don't need to even explain the epidemiology of insomnia because it's like maybe every alternate person in this world might have insomnia because at some point or the other in their life. So yesterday we talked about insomnia, what are the different treatment strategies for the same. Today we are going to talk about sleep apnea. This is also another kind of sleep disorder, and this is also very dangerous. So apnea refers to repetitive episodes of cessation of breathing during sleep. So in simple words, for example, you are sleeping and suddenly you get up in the middle of your sleep completely breathless. That means your respiratory cycle or the respiratory drive will suddenly stop in between. So the normal breathing, that is the inhaling and the exhaling that you do, will suddenly stop. So in that condition, definitely you will become breathless. And then you will suddenly get up in the middle of the night multiple times, gasping for breath. So this is not at all a good condition. And sleep apnea is also a very important reason for insomnia because you will get up in the middle of the night many times. So your sleep cycle will be disturbed, your circadian rhythm will be disturbed, and definitely you will have a very, very bad morning and the next day. And if this continues, then I don't need to explain how poor the quality of life of such people will be. Sleep apnea is classified into two. One is called obstructive sleep apnea, OSA, and the other is called central sleep apnea, CSA. Obstructive sleep apnea, in this condition, there is repetitive episode of nocturnal breathing cessation. So that is very simple term. Nocturnal means at the night time. So when you are sleeping, suddenly there will be some kind of a reason due to which you will not be able to breathe properly and you will get up in the sleep multiple times. This is potentially life-threatening, especially if you are suffering from, please remember this. This is a very, very important statement. If you are suffering or anybody in your family is suffering from obstructive sleep apnea, and they are taking any kind of CNS depressants, let it be any kind of CNS depressants, they should be on high alert because they may even die in the middle of their sleep. Because CNS depressants will always depress your medulla oblongata, your breathing capacity, because they are depressants. And already you are suffering from obstructive sleep apnea, which will further complicate the issue. So please make sure that if anybody in your family is suffering from obstructive sleep apnea, they should stay away from CNS depressants as much as possible. So there are different causes of sleep apnea. So this is usually life-threatening in nature, as I mentioned. The major cause of sleep apnea is obesity. So if your BMI is very high, that is found to be a major risk factor for obstructive sleep apnea. If you are having any kind of damage or lesions in the upper airway, so it is creating some kind of obstruction in your normal breathing process, that can also lead to obstructive sleep apnea. If you are having enlarged tonsils, so that is also related again to your respiratory system. And if you are having enlarged tonsils, that can also lead to obstructive sleep apnea. There is a condition called amyloidosis. So actually, when I was teaching to students, I put this as a YouTube link. You can refer what amyloidosis is. It is one of the most dangerous diseases in the world because it is a condition in which, due to some kind of damage to the bone marrow, there is abnormal accumulation of a protein which is known as amyloid, and that is not good for us. So if it accumulates in the heart, if it accumulates in the brain, if it accumulates in the lungs, it can accumulate and cause destruction to different parts of the body. And that is why the treatment of this disease has to be very aggressive as well. So you can refer anyways in detail what amyloidosis is. You can find it in YouTube. It will give you good presentations as to what the disease is. If you are suffering from hypothyroidism, that can also lead to sleep apnea to some extent. And definitely if you are addicted to CNS depressants, or if you are taking CNS depressants for any medical condition, means you're not abusing it, but you're taking it for some medical condition on a high dose for a long duration of time, then definitely you can suffer from sleep apnea. And that is why if the patient is obese and they are taking CNS depressants as well, because we find a lot of people like this, because nowadays many people, the BMI of most people are very huge. So if they are under CNS depressants due to any condition, maybe it is a medical cause or maybe they are just abusing it, this kind of people need to be very careful. If we look at the symptoms of obstructive sleep apnea, it can be heavy snoring, because definitely, most of the people, they snore because somewhere there is some problem with their normal breathing process. That is why actually this term happens. Severe gas exchange disturbances, because definitely your normal breathing process is, there are obstacles in the path. So definitely gas exchange will not take place properly. Respiratory failure can definitely happen, especially if you are under CNS depressants. So definitely respiratory failure is a very huge possibility. In very severe episodes, if you get up in the middle of the night, you can start gasping for breath also. So you will start behaving like somebody is trying to strangulate you. So you will gasp and choke for breath. Morning headache is definitely possible. Morning headache and irritability, that is very easily understood. If your sleep is not good at night, definitely the next morning when you get up, you will have headache and definitely you will have irritability. You will be a very irritable person because your sleep wasn't good. Poor memory also, because it is always said that when you have a very good sleep, it is good for your brain neuronal activity. And if you are not having a good sleep, maybe it is because of sleep apnea or maybe it is because of insomnia, your neurons start getting damaged slowly and slowly, but it happens. So if the cerebral area is damaged, because cerebrum is the area which controls your intelligence, cerebrum is the area which controls your thought process, cerebrum is the area which controls your behavior, whatever you think, whatever you critically analyze, cerebrum is responsible for that, and definitely for your memory as well. So if the neurons in the cerebral area are damaged, then you can have poor memory as well. And definitely excessive daytime sleepiness, that is very easy to understand, because the entire night you had so much of difficulty in sleeping due to sleep apnea. So in the daytime, you will always have a tendency to sleep. If we look at the complications of obstructive sleep apnea, it can lead to arrhythmias, it can lead to hypertension, cor pulmonale. Cor pulmonale is usually associated if the patient is already suffering from some respiratory condition like COPD or emphysema or something, then cor pulmonale can get exacerbated and it can cause sudden death as well. That is why I said this is very dangerous. The patient can, not get any breath and die in the sleep as well. And that is why whatever medications the patient is taking, we have to be very careful whether it is a CNS depressant or not. We also have to look at the BMI of the patient and do what is necessary. So if you look at the goals of therapy, you can just refer, because I don't need to mention what the goals of therapy are, because here, as I said, which are the different risk factors for obstructive sleep apnea. So we have to reduce the weight of the patient, which is very important, especially if the patient is obese. If the patient is not obese, then we don't have to do anything. And definitely, if the patient is addicted to or taking some CNS depressants, then we have to review the prescription if it is a medical cause, and if it is a non-medical cause, then we have to make the person de-addicted to those CNS depressants as soon as possible. So we can also look at the risk versus benefit ratio for the same. Anyways, coming to the treatment strategies, the most important treatment strategy is weight loss, tonsillectomy if the patient is having enlarged tonsils, nasal septal repair, it is a kind of septoplasty, nasal positive airway pressure. So these are some technical terms which you can refer in YouTube what they are. In very severe cases, definitely the patient will be admitted in the hospital or something. So tracheostomy has to be done. Avoid all CNS depressants and drugs that cause weight gain. This is very, very important, because there are a lot of medications that cause weight gain as a side effect, and there are a lot of medications that are very powerful CNS depressants. So we have to be very careful regarding the same. ACE inhibitors are contraindicated in obstructive sleep apnea. This is a very, very interesting information. So if a patient is suffering from hypertension and they are having obstructive sleep apnea as a comorbidity, ACE inhibitors are contraindicated in those patients because they worsen the sleep disordered breathing. And anyways, ACE inhibitors, they cause angioedema and all these kind of things also. So that is why ACE inhibitors should never be used. You can substitute it for any other antihypertensive other than ACE inhibitors. There is a molecule known as modafinil. So this actually prevents the reuptake of dopamine. So it actually increases the dopamine levels. It is actually good for daytime sleepiness in patients with obstructive sleep apnea. So as I told you before, because in obstructive sleep apnea, patients will always have a tendency to sleep during the daytime. So modafinil will actually increase the level of dopamine. And I've always told you that dopamine makes you alert, and anything that makes you alert will not make you sleep. So modafinil is good for that. The problem with it is causes nausea, and nausea is very easily understood because it is increasing dopamine level. So nausea will definitely happen, and it can cause headache to some extent, because anyways headache is possible because a patient who is already suffering from obstructive sleep apnea did not have a good night's sleep. And then on the daytime, you are taking modafinil, which is intended to make you active. So a patient who already did not have a good sleep is being forced to be active in the daytime. So definitely headache, fatigue, tiredness, all these things can be seen as a side effect. And definitely if dopamine level increases in the body, there are a lot of other things that can also happen. It is written here, refer the rest. I'll talk about that later. Dopamine increases, a lot of things are there. So we will talk about that in toxicology or in some other time when I talk about dopamine. R-modafinil is also another molecule. It is same as that of modafinil. It also blocks the reuptake of dopamine. So it will increase the level of dopamine in the body. So it is good for daytime sleepiness. Now we come to central sleep apnea. This is actually not that common. It is less frequent than obstructive sleep apnea. It is characterized by repetitive episodes of apnea due to loss of respiratory effort during sleep. So this usually happens when the medulla oblongata or areas related to that is damaged, because you know very well that if there is a small damage to the medulla oblongata, that can be life-threatening. Why? Because the medulla oblongata controls your heart rate and the medulla oblongata controls your respiratory rate. So if there is any kind of damage in that area, or any kind of damage, or maybe internal damage, whatever it is, that can affect your heart rate and your breathing capacity or your tendency to breathe. So this usually happens in neurological conditions, means if any kind of neurological problem you are having, then this condition might happen. Etiologies include ANS lesions, neurological diseases, to some extent high altitudes. If you are living in very high altitudes, that can cause central sleep apnea. Opioid use. So if you are addicted to opioids, because opioids are very powerful CNS depressants, so it can happen. And in some cases, congestive heart failure has also been found to be a reason for central sleep apnea. Coming to the treatment strategies, positive airway pressure with or without supplemental oxygen. There is a drug known as acetazolamide. So acetazolamide actually causes metabolic acidosis, and metabolic acidosis stimulates the respiratory drive. So because always remember, whenever you have metabolic acidosis, if you see any patients with metabolic acidosis, if you look at the breathing pattern of those patients, you will find that they will always gasp for breathing. Or this kind of patients always report that they are having a burning tendency in their chest and they always want to breathe. So acetazolamide side effect, which is metabolic acidosis, can be exploited for this. Because in central sleep apnea, you don't have a tendency to breathe on your own. So acetazolamide will cause metabolic acidosis, which will stimulate your tendency to breathe. Although it causes gasping and all this thing, but still it will stimulate your breathing tendency. So this may be beneficial. For example, if you are going for trekking or trips on high altitude areas where the oxygen level is low, it can be good in some conditions like CHF, and definitely in idiopathic causes of central sleep apnea. Let me tell you something very interesting about acetazolamide. Acetazolamide increases the level of ammonia in the body, because acetazolamide and ammonia are best friends. I'll tell you why they are best friends. If you look at the word acetazolamide, if you look at the last 5 alphabets, amide means NH2ONH2 or NH2C double bond ONH2, which is a urea kind of product. So definitely it will increase the level of ammonia. So acetazolamide or carbonic anhydrase inhibitors are contraindicated in patients who are suffering from liver cirrhosis. Now I'll tell you why. The liver has a detoxifying property. The harmful ammonia that is formed in the body is detoxified by the liver into less harmful urea, which is eliminated. But if the liver is damaged in chronic conditions like liver cirrhosis, and especially if we are taking abnormal protein intake, or even otherwise also, there will be no liver to detoxify the toxic ammonia that is building up in the blood, which is known as hyperammonemia. This ammonia will cross the blood-brain barrier, go into the CNS, and cause a condition known as metabolic encephalopathy. And metabolic encephalopathy is life-threatening in nature because it can cause hallucinations, it can cause delirium, confusion-like situations, and it can lead the patient into coma. So that is why acetazolamide is contraindicated in patients who are suffering from liver cirrhosis. Another interesting fact of acetazolamide is it has a sulfonamide structure. So if you are allergic to sulfonamide antibiotics, you should never use carbonic anhydrase inhibitors because cross hypersensitivity may be seen. Acetazolamide usually makes the urine very much alkaline because acetazolamide causes metabolic acidosis. So the urine will always be alkaline. So what happens is that insoluble calcium salts get crystallized there because calcium salts will not get dissolved in alkaline urine. So that is why acetazolamide can cause renal stones to some extent. So that is why in kidney stones or nephrolithiasis, which is involving the role of calcium, carbonic anhydrase inhibitors should not be used because it will further worsen the condition. So like that, there are some interesting things. I just thought suddenly acetazolamide came, so I just thought that I will share with you. Now we are coming to narcolepsy. So narcolepsy is a condition in which you have daytime sleepiness and you can't predict when you will suddenly fall asleep. Means even if you don't want to fall asleep also, you will just fall asleep like anything. So it is a chronic sleep disorder characterized by excessive daytime sleepiness and sudden attacks of sleep. So it is almost opposite to that of insomnia, where you are completely awake like anything. Here, you can't predict when you will fall asleep. So this kind of people will lack energy like anything. They will always be lethargic, because even if they get a sleep attack, it will not be of a very long duration. Suddenly they'll get up and suddenly they'll again feel like sleeping. So it is a completely, haphazard situation. So hypocretin or orexin neurotransmitter system plays an important role in keeping you awake, alert, and memory enhancement. So hypocretin or orexin usually keeps you alert, it keeps you awake, and it's good for your memory. If there is autoimmune destruction of hypocretin producing cells, narcolepsy can occur. So there is no significant reason as to why narcolepsy happens. This is just a theory. Autoimmune destruction. Autoimmune means your body's immune system considers that particular part of the body as enemy and sends antibodies towards it. So that is called an autoimmune disorder. So if there is an autoimmune destruction of hypocretin producing cells, this condition can happen. So since it is an autoimmune destruction, this condition is usually incurable. Always remember, autoimmune diseases, let it be any autoimmune disease in this world, it is incurable. Because autoimmune disease means your body's immune system is hyperactive. And you can do nothing to suppress the hyperactivity. You can only maintain it. And that is why we use immunosuppressants in autoimmune condition, but that has to be used forever. You can take any autoimmune disease you want. They are all incurable. You can take SLE, you can take psoriasis, you can take rheumatoid arthritis. All of this are autoimmune in nature and they are incurable. If you look at the clinical manifestations of narcolepsy, it is first is cataplexy, sudden bilateral loss of muscle tone with collapse. So this kind of patients, when they suddenly get a sleep attack, people will think that they felt dizzy and they fainted. But actually it is not that they fainted. Narcolepsy is a condition in which your muscles completely get paralyzed suddenly and you have no other choice but to fall down and sleep. Excessive daytime sleepiness, sleep attacks of 30 minutes duration. Just imagine, suddenly you are getting a sleep attack. Even if it is of a 3 or 4 hour duration, it is still understood. But you will only sleep for 30 minutes. After that, you will again wake up. Again, for some time, you may be active. Again, you will get a sleep attack. And this saga goes on and on and on. So definitely this kind of people will definitely be fatigued, because 30 minutes duration sleep is just like a nap. So if you are having so many naps in the daytime, that is not at all good. And definitely if you are sleeping so much in the daytime at a 30-minute duration, definitely you will not feel sleepy at night. So that will convert into insomnia. So this is a very notorious condition. And definitely your performance will be impaired, especially if you are a student, or if you are a geriatric, it's okay. You are retired, you are staying at home, it's fine, still fine. But if you are a student or if you are a professional working somewhere, definitely this is not a good sign. And especially if you are a person who does job in very dangerous sectors. For example, you are dealing with dangerous chemicals, or you are doing those kind of a job where you have to do driving. For example, you are doing Amazon delivery, or you are doing any kind of delivery service. That time, if suddenly your muscles get paralyzed and if you fall sleepy, you can predict what will happen. You can have an accident, or you may even face death. That is why this condition is very dangerous. Goals of therapy, I don't need to tell you much. There are lot of similar points that can be said to maintain the therapeutic window, to maintain a good quality of life, blah, blah things. So these are some of the drugs that can be given for cataplexy and for excessive daytime somnolence. It has just been divided into two. We can give all these medicines. Actually, I have written refer here because when I used to teach to students, I had already explained about all these medications. So anyways, I will be talking about all this in some or the other therapeutics chapter or maybe toxicology or pharmacology. So I'll be explaining. Anyways, I'll just explain in short about all this. Dextroamphetamine, you know very well, it's an amphetamine derivative, which is a CNS stimulant. Amphetamine is a CNS stimulant. That is why we use it for daytime somnolence, so that it keeps you active. Methamphetamine is again a CNS stimulant. Lisdexamphetamine is a CNS stimulant. Methylphenidate. Methylphenidate is also used for attention deficit hyperactivity disorder in children. Modafinil and armodafinil, I already told you, they are dopamine reuptake inhibitors, so they increase the level of dopamine. And sodium oxybate is almost kind of the same. When we talk about cataplexy, fluoxetine is good. It is a selective serotonin reuptake inhibitor. So it keeps your muscles active because it increases serotonin. Imipramine, nortriptyline, and protriptyline, these are tricyclic antidepressants. So they also increase the level of serotonin. They somehow, keep your muscles active. Venlafaxine is actually an SNRI, serotonin norepinephrine reuptake inhibitor. So that is also good for cataplexy. And selegiline is a MAO-B inhibitor. We have 3 MAO-B inhibitors: selegiline, rasagiline, and safinamide. So selegiline is good. Now let's come to the patient counseling for insomnia. Yesterday I was talking about insomnia. So we'll talk about what are the patient counseling that we can give. Please eat diet rich in potassium. Always remember, potassium is a good friend of your sleep. Magnesium is a good friend of your sleep. If you are having deficiency of potassium, if you are having deficiency of magnesium, you can assure yourself that you will never have a good sleep. And that is why patients with hypertension have a very difficult time sleeping properly, because patients with hypertension means their potassium level may be low and their magnesium level may be low. And that is why we advise patients with hypertension to increase their diet rich in potassium and magnesium. So, and obviously potassium and magnesium keeps you energetic also. So the entire day you will feel energetic, and at the night you will have a good sleep. So eat diet rich in potassium. So we have so many diets which are rich in potassium. Green leafy vegetables are the best examples. So it helps your body feel relaxed so you can sleep better. You can increase your intake of food which is rich in tryptophan. Tryptophan is an actually amino acid. So it stimulates the release of serotonin, which helps to relax you. Dopamine makes you alert. Serotonin makes you relaxed. Foods rich in tryptophan, they are usually proteinaceous diets. Any kind of vegetarian or non-vegetarian high proteinaceous diets, they are rich in tryptophan. So you can take this kind of food at dinner time for maximal benefits, but please make sure of one thing. If it is a summer season, if you are already suffering from acidity or diarrhea kind of conditions, then please make sure that you don't overeat on proteinaceous diet. That can worsen your condition. It can be counterproductive. You can take complex carbs, so that helps to release serotonin. For example, sweet potatoes. Raw milk is also good. Anyways, you have seen in movies and all this, people drink warm milk and all this thing at night time. So that is good for actually, stimulating your sleep, especially if you add a little bit of, a very small pinch of turmeric on it. So that will give you excellent results. Raw milk, it focuses on organic. You should focus on organic, unpasteurized, unsweetened raw milk. So that helps in improving your sleep. Please eat food which is rich in magnesium. It is a relaxation mineral. It also fights muscle cramps. I've already told you that females who are having premenstrual syndrome and they are having any kind of cramps, or they are suffering from migraine due to premenstrual syndrome or due to the menstruation, magnesium is a boon for them. So it fights muscle cramps and headaches that can cause insomnia. So for example, oats, sesame seeds, sunflower seeds, raw dairy, green leafy vegetables, etc. So sesame seeds and sunflower seeds, they're also very good for reducing your body weight, especially your belly fat and all these things. So if you take it with oats, it's a very good diet as well. Increase your intake of food which is rich in B vitamins, especially vitamin B12. Vitamin B12, I don't need to explain much. If you are deficient of vitamin B12, you can have symptoms of neuropathy, burning like sensation or paresthesias in your body. So vitamin B12 is very important. It makes you active. So if you are having vitamin B12 deficiency, you'll always feel tired, even though you had a good sleep. So usually vitamin B12 is rich in non-vegetarian foods, but you can find to some extent in green leafy vegetables as well. So organic meat and liver, any animal liver, and green leafy vegetables are good sources. Avoid caffeine. Caffeinated beverages you should not take after at least 8 p.m. if you are suffering from insomnia, because there are two reasons for it. First reason, caffeine is a CNS stimulant, it will keep you awake. Second reason, caffeine is a very powerful diuretic, because if you remember the drugs for asthma and COPD, if you can see that there is a molecule known as theophylline. It is a caffeine derivative. So theophylline actually increases urine production also. So if urine production increases, you may get up in the middle of the night multiple times. So that can be dangerous for your insomnia. Avoid caffeinated or caffeine beverages post-afternoon. Switch from coffee to green tea. But again, green tea is also having good concentration of caffeine, but not as much as the pure coffee. Avoid alcohol. Stop drinking alcohol at least 2 hours before bed. Don't drink more than 1 to 2 drinks per day. But I will usually advise people to not even focus on 1 to 2 drinks per day also, because that will slowly make you addicted. I don't understand what the fun is in drinking daily. So why alcohol avoidance is mentioned here is because it depends on the concentration of alcohol. Alcohol is a CNS depressant, so it actually should make you fall asleep. But the problem is that there are different stages of alcoholism. When I'll talk about ethanol poisoning, I will explain this in detail. In the initial stages, actually, alcohol makes you energetic. So that stage can again make you insomniac. You will feel like you can do a lot of activities. But after that, it becomes a CNS depressant. So you will have the sleep and then the hangover effects and whatever. Avoid any potential food allergens, because food allergies can cause restlessness, because the logic is very simple. If you are allergic to something, histamine is released. And I already told you that histamine makes you alert. So that can lead to insomnia. Avoid dairy product, gluten or nuts if you are allergic to it. Most of the people are usually allergic to this kind of thing. Or there is another product called maida. Many people are allergic to maida products also. Avoid sugar. Now, avoid sugar is very easy to say, but it's very difficult to advise people. But if you are taking too much of sugary diets at night, so that can cause sugar crash, because when you take too much of sugar at a single stretch, large amount of insulin will be produced to counteract it. And insulin will suddenly reduce the blood glucose. So that can, make you insomniac. So it will, make you anxious, it can, make you troublesome when it comes to sleeping. So variations of blood glucose levels can cause symptoms of anxiety, nervousness, and trouble sleeping. So at least at night time, try to avoid high sugar diets. Daytime, okay, but at least at night time, try to avoid high sugar diets. Avoid processed fats because too much of fat at night slows down the digestion. That can lead to indigestion. So you will start having burps, you will start having acid reflux. So though obviously it's not a good indication. So you may get up in the middle of the night with, heartburn and, reflux and all this kind of things. Already, if you are suffering from peptic ulcer disease or gastroesophageal reflux disease, then I don't need to tell you how dangerous this can be. So avoid fried foods as much as possible, junky foods and fatty meals at bedtime. If you are cooking at your home, then please focus on healthy fats like coconut oil, olive oil, avocado, ghee to some extent. Avoid stress as much as possible. I'll never tell you to, completely, stop stress, because as I say to people, stress is not a button that you press the button and instantly stress disappears. So obviously you may be suffering from a lot of conditions. So as much as possible, try to troubleshoot it. Deep breathing and meditation exercises, it's very easy to advise in this Kali, but it's not so easy because the entire world is very, very busy. Everywhere there is disturbance. So if you want to do deep breathing and meditation exercises, please try to do it early in the morning when the entire world is silent, because all these things make sense only when the atmosphere is silent. If some music is happening everywhere, somebody is shouting somewhere, somebody is discussing somewhere, there if you sit with your legs crossed and you think of meditation, it is not meditation, it will be completely bullshit. So deep breathing and meditation exercises, if you are doing at late night, some people, if they can't get up early in the morning, you can do it at late night also. That time also, if the entire atmosphere around you is silent, or any time when the atmosphere around you is silent, in early morning, if you are doing, you get the best results. Supplementation with calcium and magnesium. Melatonin supplements may be good. As I told you, melatonin supplements are available online. But again, I'll tell you, please make sure if you are taking melatonin supplements, your sleep should not be disturbed by any external forces. Because if your sleep is disturbed and your sleep quality isn't good, the next day when you get up, you will have headache and you can have irritability and drowsiness as well, because melatonin will still function. Vitamin B12 supplementation is good, and definitely aromatherapy. If you can take a diffuser, it is a machine, and on that if you apply a little bit of rose water, and then if you apply chamomile oil or lavender oil, even sandalwood oil is also good. So these oils are good, they will slowly release the smell throughout the room. So it gives you a positive energy, it calms your muscles, it calms your brain, so it can give you a good night's sleep. Patient counseling for sleep apnea. Please make sure that you maintain your body weight. Body weight is very important because obesity is a very big risk factor. So you can eat a high fiber diet, vegetables, fruits, nuts, seeds, sprouted beans and legumes. Improve your protein intake, because higher your protein intake, that is also good for reducing your belly fat. It's a kind of a ketogenic diet, what we talk about. Use healthy fats, get regular exercise. Again, look at your age and look at your other conditions, only then you go for exercise. Because if you are suffering from severe arthritis or if you are suffering from heart failure and you go for intense exercise, then it will be hell for you. So look at your age, look at your condition, and then do modest exercises as necessary. Use essential oils for weight loss. So we have grapefruit, cinnamon, and ginger oil, which are, which have shown promise in reducing body weight. Avoid excessive alcohol, smoking, and overuse of sedatives. I don't need to explain why, because excessive use of alcohol means it's a CNS depressant. Smoking, although it is a CNS stimulant, but if you are addicted to that, or if, the nicotine, that if you are addicted to nicotine and suddenly you withdraw from it, it will start showing the symptoms of CNS depression. That is not good for sleep apnea. And overuse of sedatives, I don't need to explain. They are CNS depressants. Treat acid reflux, congestion, and cough. So if you are suffering from gastroesophageal reflux disease or any kind of congestion in your pulmonary system, make sure that you treat them time to time. Humidify your bedroom. So it helps to reduce snoring, congestion, and improves your breathing. And actually, we advise people who are suffering from asthma and COPD to use humidifiers in their room, especially where they stay for long periods and where they sleep, because it reduces the congestion in the pulmonary system and it improves the breathing. Obviously, please make sure that you buy a good quality humidifier. Don't look at cheap rate humidifiers, but it will be counterproductive for you. And obviously, if you are suffering from COPD or anything like that, there is a very good remedy. That is, you can take some camphor. You can, mix it in eucalyptus oil, or you can use it on mustard oil also. Eucalyptus is much more better. You can mix that camphor in that eucalyptus oil and you can do a chest massage. So that is very good for patients who are suffering from any kind of airway disease, especially emphysema. So it naturally helps to open the airways. This you can definitely try. Adjust your sleeping position. Sleep on your side using a pillow so that your head is elevated a bit slightly. You can sleep on your stomach, not much of an issue, but please never sleep on your back, especially if you are suffering from sleep apnea. So if you have a tendency to sleep on your back automatically, you can keep 2 pillows in between yourself. So naturally, the tendency to sleep on your back will be reduced. Patient counseling for narcolepsy. Maintain natural sleep cycle. So if you are always having a tendency to sleep at daytime, and if you are working somewhere, you can yourself make a disciplined schedule of power naps. Power naps is a nap of 30 to 45 minutes. So that you can do on your own. Don't overactive yourself. Don't make yourself overactive. Don't try to suppress the tendency of narcolepsy, because the more you try to suppress it, the more dangerous it becomes in the near future. So if you schedule a power nap, to some extent, narcolepsy will remain silent. Vitamin D is good because vitamin D deficiency causes fatigue. Obviously, it is not good for your bones if you are vitamin D deficient. It is not good for your immunity if you are vitamin D deficient. And definitely, if you are deficient of vitamin D, then definitely fatigue can be seen. So that can lead to cataplexy and narcolepsy. So make sure that you do morning walks. Now, morning walk doesn't mean that you are walking at 9 o'clock or 10 o'clock in the morning. Let it be any climate, let it be any climatic condition. If you are doing early morning walks, at least any walk before 8 o'clock in the morning is good, because the rays that come from the sun are rich in vitamin D. Exercise, even if you're suffering from depression, early morning walks are good, because vitamin D deficiency has also been implicated to cause depression. So if you are doing early morning walk, that can be good. Exercise, yoga, walking. Exercise actually helps to reduce depression, brain fog, and poor sleep quality. So again, I'm telling you, exercise doesn't mean that you should go for intense exercises. There are a lot of people who, get that adrenaline rush for intense exercises, and they had a sudden cardiac arrest and passed away in the process. They were very young people. So look at your condition, look at the comorbidities that you're suffering from, and then schedule or decide which kind of exercises will be good for you. Omega-3 fatty acids, they improve your cognitive function and performance. That I don't need to say, it's good for the heart also. It is safe for children and pregnant women also. It's not like pregnant women cannot take omega-3 fatty acid supplements. They can also. So there are sources. You can take it in supplement form, which is much more concentrated, or you can take it in food form. So we have salmon, sardines, mackerel. These are all different kinds of fishes. Dairy, flax seeds, and walnuts. These are rich in omega-3 fatty acids. Improve your intake of vitamin B12. That is good for your memory, mood, and energy. Definitely narcolepsy, all these 3 things will never be there. So vitamin B12 supplementation is good. So as I said, that it is much more seen in non-vegetarian foods, but you can find to some extent in green leafy vegetables and cottage cheese, but it is found in liver, salmon, mutton, and eggs. Lifestyle therapy, for example, acupuncture therapy, very fine, minute needles are actually inserted or pricked on your surface of your skin. That actually improves your blood circulation. So that actually makes you feel relaxed. Massage therapy is also good. Nowadays in metropolitan cities, we have a lot of apps in which, if you are having a very busy life schedule, can book for massage therapies and all, and people will come and do. Obviously, it is very costly, but there are options like that, or you just go for a spa or a massage therapy, maybe once or twice in a month, which may be good. And definitely aromatherapy. Aromatherapy, very simple. You just have to take a diffuser. It is a machine which actually spreads that smell of that aroma. You just need to apply little bit of essential oil, which is mixed with rose water, because rose water also has a good smell. And you can mix maybe a eucalyptus oil, sandalwood oil, rose oil or something. Please make sure that you don't keep it burning all the time, because after some time the entire liquid will go and then the diffuser may get burnt or burst also. So before you sleep, you just keep it on for some time, maybe half an hour or 1 hour or something, and then you turn it off. You will have a good night's sleep. So that's it. With this, my presentation on sleep-wake disorders is over. This has been a very long presentation. It had to be divided into 2 parts. So I hope that I have been of service to you. I hope that I have given the best knowledge that I could give. If you have any doubts or clarifications or confusions, you can contact me in LinkedIn, or you can comment in the comment section below. I'll try my level best to answer you back. This is a very common disease. This is not very commonly found in most of the presentations around. So I just thought that I should talk on this. So just look into these 2 videos, part 1 and part 2. And as I said before, if you appreciate my efforts, because these efforts are not a joke, it takes a lot of time, lot of energy, lot of referencing to make all this what I have done. So if you appreciate my efforts, then please do share and subscribe to maximum people, because as I always say, knowledge is power, and knowledge shared is knowledge doubled. So see you in the next video. Until then, it's goodbye and good night.